everybody, it's Sandy and welcome back to my channel dedicated to helping you advocate for your own health one topic at a time. So guys, today I am at week 8 after my CMC arthroplasty for the arthritis of the thumb joint. It's down here where the thumb meets the wrist. I can't believe what a corner I've turned and how much difference some time makes. It seems like no sooner do I put a video online in which I talk about some tips and tricks that I have a few more. So I've got a few more for you today. Just keep watching. Yeah, so first of all, I want to say thank you and welcome to my channel. For those of you who haven't subscribed, if you find my content helpful, I hope you'll consider subscribing and please share with anybody who might find that content helpful. I've been a nurse anesthetist for over 30 years now, and I started this channel sort of as my way of giving back as a public service, if you will. So of course, I'd love to grow the channel and thank you in advance for your help. First of all, you guys, I can't believe what a difference it is. For me, 8 weeks, I turned a corner. I don't know if it's about the number of weeks. It's probably where I advanced to in my occupational therapy, but all of a sudden I'm like forgetting my brace. I actually drove to occupational therapy and realized that I had completely forgotten to wear my brace. So I am just so happy with this. I've also become convinced beyond anybody's ability to convince me otherwise that the earlier mobilization is just better. I know surgeons are all over the board, and I read in the Facebook group on basal thumb joint arthritis group where people post what their timeline is, and most people are in casts for 4 weeks, 5 weeks, some more. Well, a few people are barely immobilized at all. So having the experience that I had where the cast was cut off early, it was supposed to be there for like 5 weeks, it was about a week that I was casted. I can honestly say that just getting moving was about the best thing that could have ever happened to me. So I'm so pleased with that. All right, so on to these tips. Let's get into it. The first thing I want to talk about has to do with care of the scar. So I did an earlier video in which I talked about the silicone product that I put on my scar. It's Kilo Coat. Yeah, so here's that Kilo Coat. I won't go all into it since I discussed it in a previous video, but I will put it down below in the description box. Now, in addition to the silicone, what I did not mention in that video is that it's also important to have some sunscreen. Now, of course, you're not going to do any of these things until your surgeon says that it's okay to start massaging the scar and doing things with the scar. But once you're there, it is going to be so important to put on sunscreen because this area, where this scar is not going to tan. It's going to show up as a bright white pigment. It's also very delicate, like new skin, so it is going to be so important to use sunscreen on that. I said in a previous video that I did on the sunscreen I use on my face that I'm really only using physical sunscreens these days. I'm not going to use any more chemical sunscreens, particularly on my face or on something that is delicate and healing like this scar. Maybe elsewhere on my body because it's hard to find a physical sunscreen that's really emollient and not like ridiculously expensive to use over a large portion of your body. But for now, I'm using just exactly what I use on my face most days, and that is the Olay Regenerist Mineral Sunscreen. So this is a completely zinc oxide. I did a video review on it a while back, and I'm going to link that video right here. I find that this is very spreadable. It disappears unlike most zinc products. There are many products out there that you can try, but I do recommend that you make sure that this area is well protected from the sun. Now, when this really came to mind for me was when I was driving. My husband and I took a trip out for a long weekend, and when it was my turn to drive, there was the sun beating down right on this scar, and I thought to myself, wow, I wasn't planning to be outside in the sun. I'm just driving in the car. Yeah, you'd be shocked how often the sun is directly on your hands. I actually put my brace on so that at least this area was covered. But from that day forward, I have made sure first thing in the morning, when this goes on my face, it also goes on my scar. My second tip is make sure to take care of your gut microbiome, and probably better do that before surgery rather than after. First of all, usually in orthopedic surgery, it's very typical they hang an antibiotic in the IV. It goes in pre-operatively. So usually you have just one dose of that. And after surgery, you're going to be on some kind of pain reliever, right? Well, in my case, I was so happy to see that my surgeon prescribed Toradol, not to be confused with Tramadol. Toradol is an anti-inflammatory, so similar to Aleve, Advil, and things like that. Toradol is a very powerful anti-inflammatory that is excellent in terms of resolving bone pain. Now, I remember back when Toradol first came out, and I was doing a lot of orthopedic cases at that time, and I always made sure to put Toradol in the intravenous line for my patients who were having orthopedic surgery. I had never taken Toradol by mouth, and there are warnings all over the label, and there's a reason that it says don't take it for more than 5 days. So in my case, I was taking it like once a day, and my surgeon told me, taking this only once a day, it's really safe if you just continue. Yeah, I don't know. I went on, I took it for the better part of that month. only once a day, and it was kind of subtle at first. It took me a while to figure out what was going on. And actually, I'd already stopped taking the Toradol before I realized that I had really changed my gut microbiome, and I had that gnawing, almost like ulcer pain in my stomach. It actually got kind of scary. So I would just say be careful. I don't want to scare anybody. It's just that these days, like, narcotics are the devil. So usually they prescribe you a narcotic and an anti-inflammatory, and you try very hard to get off of the narcotic first because we know all the dangers of that. I think we sort of take lightly the dangers of the anti-inflammatories. So certainly if you're going to take one of the anti-inflammatories, I'm not saying don't take it. Discuss this with your own provider and keep your own history in mind besides, but do make sure to take those on a full stomach. Now, at some point, I had stopped using the oral anti-inflammatory, and then I moved to the gel, which I had talked about this in a previous video. It's excellent, the diclofenac gel. But once I realized that my gut was so upset, I decided I was going to stop this too. I don't think this really can have a profound impact on the gut, on your GI health by itself. Although it's hard for me to believe that if that switch has already been flipped and maybe there's a raw area in the stomach, adding almost anything, even a negligible amount of absorption, probably isn't good. So I stopped taking this for now at least. And that brings me to my next recommendation, which is I started using Arnicare. So there's an Arnicare gel and there's an Arnicare cream. They are both fantastic. They both work very well. Of course, I'm on week 8, so I don't have a whole lot of pain. What I have is like some stiffness in the morning. Certainly, if I do a vigorous session of occupational therapy, it can kind of get hurting. So I don't have a high level of pain anymore, but I do have some soreness and stiffness, and so I have been using both these Arnicare products. I generally use the cream like morning and night. Like, I'll moisturize my hand with this, and then over that, I will put the silicone product. And then over that, I will put the sunscreen. And at nighttime, I just use it by itself. And during the day, it's sort of like top-up doses, if you will. I'll use the gel. Both these products contain only arnica in terms of the active ingredients, so they don't have any other anti-inflammatory or salicylate, which is like an aspirin-type substance. They only have the Arnica montana, which is the herbal relief, and the inactive ingredients. And I'll just let you have a look at the consistency of it. So this one is the cream, and you can see it's a pretty nice consistency. I can put my hand up and down and nothing's runny. It's very, let me see if I can give you a close up. It's clear. It's a pretty thin cream. I mean, it certainly has enough substance that it doesn't drip and move all over the place, but once you put it on, it's like a very thin layer and you very quickly forget that it's even there. It does feel nice and moisturizing. Now, as far as the gel, of course, that's a little more runny, a little more liquid as it is a gel. I almost expect it to be cooling just because it's a gel. You know, there's something about it that feels a little cool coming out of the tube, but even it's pretty thick. I mean, it's not going to fall around like, for example, BioFreeze gel. And I also like BioFreeze gel, by the way. There you go. In a previous video, I talked about a mini hand massager that I had used at physical therapy, and they had actually said they were available for sale for like $20. And I thought, wow, did you lowball yourself? Well, at that time I did the video, I said I hadn't found one on Amazon, but I since have. So it's the Royland mini massager, which looks exactly like this. I don't know if there's just like a different name that maybe is being sold to professional settings like the occupational therapist setting, but it looks exactly like this. I'm going to link it down below in the description box. Now, it comes with the same exact 3 attachments that I have. The one that I usually use is just this flat disc. This little piece on the top is removable to clean, and you can get in and clean under it. And you just snap it on here, and that's it. One of the nice things about this is that it can be used for scar massage. Again, you have to check with your own surgeon and your occupational therapist and see whether it's time to start doing anything with the scar. But you can do this when you put your moisturizer on, and you can just massage it in all around the scar with the mini massager. Now, it also comes with a couple of other attachments. This one in particular has this like really soft rounded head, and it's really good for getting into this webbing. I don't know about you guys, but my occupational therapist told me that it's really good to massage in here because this area can get so tight on you. And finally, there's this one that has kind of a little pointy tip. I can't honestly say I've found many uses for this one, but of course I'm keeping it safe in the bag. Anyone who's already used this product and likes it, let me know if you found an application for that particular tip. Now, in addition to that tiny little hand mini massager, I have also found that I am very grateful for having bought a mini massager that's for elsewhere on the body, because I don't know about you guys, but especially early on when my wrist was immobilized, my shoulder was killing me. And I read that this is actually very common because the wrist pivots in so many different directions. And when that stopped, the only way to get the pivot that you need in the exact angle for the hand or the whole arm in general is to be moving the shoulder. And especially when I went to occupational therapy, I noticed that this was very common. This is something they're very used to working with, but my shoulder was in really bad pain. So I got this massager on Amazon. It's called the Upmostek. I don't think I've got the name pronounced correctly, but I'm going to put it down in the description box as well. It's like $35. There is a 15% off coupon, at least as of the time I'm doing this video, that you can just click in the description of the item. It looks like this. It looks like a gun. It has different attachments that you can put on here. I'm mostly using the ball attachment because it kind of gets into that soft tissue, you know, right in around the shoulder and the neck. It has all different settings. So it's got like 1, 2, 3, 4 speeds. You turn it on by giving it one hard press, and then you move up or down by, you know, one short press at a time. Unlike the mini hand massager, which takes, I believe, a C battery, this does not take any batteries. It has a little port here for a USB recharge. It doesn't take long at all. I've had this for at least 3 months now, and I think I've recharged it once. I can't say I use it for really long extended periods of time, but I definitely have been using it now. It also has a little tethering device. It has an attachment with these little bumps on it, and I actually have even used that right down here in that thick pad area under the thumb lightly. It feels great. I've also used that like up higher on my wrist. And then it has one of these guys. I think people like to use this on the neck. Let me know. I can't say I really get a lot of use out of this particular attachment. Okay, and finally, I think I might have saved the best and the most exciting thing, in my mind at least, for last. That is this Leaf, I hope I'm pronouncing that correctly, hair dryer. Guys, I can't believe how much nicer life is with this given my hand situations. This hair dryer is like 12 ounces. So the person who does my hair, she has dryers in her salon that are about 11 or 12 ounces, but they're about $500. So this thing was under $30. As of this moment, when I'm doing the video, there is a coupon click in the description on the Amazon page for this. I think it's an additional 5% off. Guys, they totally lowballed themselves here as far as I'm concerned. So this happens to have a super long cord. Now, I don't know about you guys, but I have a problem with hair dryers that have a short cord. First of all, just the distance from the outlet to the end of the countertop, which is the minimum distance I can stand away from it, that's already like, what, almost 2 feet? So this thing just goes on forever, and I can move around if I want to see the back or something, because I'm like trying to get the back of my hair brushed out. It's really great in terms of that. It does have only this one attachment. So if you, for example, like a diffuser or something, you're not going to be happy with this. Now it has a low setting and a high setting. You can't change the heat setting independently of the high-low. So the high is the warmer setting. I wouldn't say it's super hot. This is only 800 watts. So if you have like super thick curly hair, something like I've never had, you know, this might take you a while. This does take a little bit longer than my previous dryer used to take me, but honestly not that much. So the thing that I think is so ingenious and unique to this particular hair dryer, and still sets it apart from others that are in its weight range, so at 12 ounces, is that not only is it so lightweight, but usually hair dryers have 2 perpendicular planes, right? So there's the handle, and then the dryer actually comes off perpendicular to it, right? What that does is it makes your hand counterbalance that extra weight because it's lopsided. This is just one straight stick. So as long as you can get your hand around it, in the very early days after surgery, I don't think this would be possible. And really, how are you going to be doing your hair right after you have surgery? But once I could, you know, move my thumb and get it around it. Now, I am always careful not to like do something like this to hyperextend the thumb. I've been told that for the rest of my life, I have to be careful. Try to keep that PIP joint, try to let it do more of the work, and it relieves some of the work on the joint over here. So you don't want to be like all the way out and hyperextending the thumb. So I can do this very easily, and again, it's only 11 ounces. So, you know, I find that the way to make it a quicker job than it would be otherwise is to start out with, first of all, almost dry hair. I don't really start with soaking wet hair anyway. And I pick up a section and I just dry it at the roots. And I do another section dry. When the roots are all dry, then I'll go through with a brush, and that's kind of the work. This has allowed me to like just start doing my hair again. Okay, honestly, I was just putting my hair up in a ponytail all the time. I really do like having this, and I don't think I'm actually going back to my other dryer because I just think this is so much easier on the hands and the wrists. Even I think when I'm 100%, I'm not going to go back. Now, one thing to be careful about is the intake valve, because usually an intake valve is opposite where the air comes out, and that's the area you have to clean and dust. For this one, the intake valve is right down here. So first of all, you probably don't want to be covering it too much with your hand, but you also don't want to get this right up in your hair because it'll kind of suck. You know, you might feel your hair being pulled on this intake valve. I read that in the comment section actually when I was reading some of the reviews. I can't say that I've had a problem with that. I mean, I tend to, you know, this is the part near my hair. If I'm using a brush, everything's out here. I don't really get this right close to my head. But it's good to know that this is where your intake is. Now the dryer also comes in its own little velvet black bag, so this is really nice for traveling. And even if you're not traveling, you might just want to put this thing away. It's so lightweight, it's not like it needs a place on your countertop. You can like slide this in a drawer. Now for anybody who does have lots and lots of really thick, beautiful hair, God bless you, I don't know what that would be like. I don't know that this would work unless you just have all day. I did find another dryer that was also lightweight. It was 1 pound. I tried that one as well, but that's the one I sent back because I chose, you know, to keep this one. The other dryer is by the brand name Vanina. I hope I'm getting these names right. I'm going to put it down in the description box as well. It is an 1800 watt dryer. It is also lightweight at 1 pound. However, it has the traditional shape of a blow dryer. So there's the perpendicular lines. And I just felt that, you know, I don't know if there's that much difference between 12 ounces and a pound. What's the difference? 4 ounces? It shouldn't be that much. So I was thinking that maybe it really has to do with the counterbalancing of the weight. This thing was just king for me. But, you know, 800 watts, for some people, this really might not work. So I'm going to put them both down below. Yeah, and the best news is, again, that I just feel like I've turned such a corner. And not only do I know because I, like I said, forgot to wear my brace, but also I find that I'm thinking about when to do the next hand. I couldn't even bring myself to think about that. I had been saying for the last, about 7-8 weeks that I didn't know what I was going to do. I just wasn't going to be able to bring myself to get the other hand done. And now I can honestly say that this hand is so much better that I kind of want this one done. I am going to try to wait. I'm hoping I can get a good year just because other aspects of your health sort of suffer when you are recovering from surgery. I mean, it's not like when I was 25, so I'm pretty deconditioned now. I just have to tend to other things about my body and my overall wellness. So if I can get that time in between, that'd be great. But I have a sense now of just how finite this is and just how good it can be. And I hope that's helpful to people. So let me know if you guys find this helpful, if you have any other tips or tricks that you've learned along the way to help you through the recovery after the CMC joint arthroplasty or really any kind of hand problems. And until next time, be well. Bye-bye.